The animal is unable to breathe due to paralysis of the muscles which control breathing. Treatment of infected cats that have developed clinical signs is not considered effective and is therefore not recommended. Because of its zoonotic nature, rabies is one of the only vaccines required by law in many regions of the country. Each state or municipality has laws specifying the age at which an animal must receive its first rabies vaccine and the interval in which subsequent boosters should be given. This interval ranges between 1 and 3 years, depending on the age of the cat, the type of vaccine, and local regulations. The AAFP highly recommends this vaccine. The next vaccine we will discuss is the feline leukemia virus vaccine. Feline leukemia virus is believed to cause more deaths than any other feline infectious organism. The virus is transmitted through infected saliva, tears, and urine. Mutual grooming, bite wounds, and in utero are other common modes of transmission. The virus typically affects lymph nodes, bone marrow, and intestinal tissues. The virus typically causes immunosuppression, tumors or other abnormal tissue growth, and profound anemia. Outdoor cats are at greater risk due to their increased likelihood of being bitten by an infected cat. This makes it very important to get every cat that has exposure to free-roaming cats vaccinated prior to contact, and to test all cats in the household to make sure they're free of infection. The AAFP recommends this vaccine based on risk of exposure. Prior to a cat being inoculated with a feline leukemia virus vaccine, a blood test should be performed. Cats confirmed to be infected with feline leukemia need not be vaccinated, as there is no current evidence suggesting the vaccine is effective in viremic cats. The last vaccine we will examine is the feline infectious peritonitis, or FIP vaccine. FIP is caused by a coronavirus that is transmitted via the oral fecal route. It is estimated that in most multiple cat environments, like some shelters and catteries, 35 to 75% of cats will be infected with feline coronavirus and shed the virus through the feces at any given time. Although many cats are or have been infected with feline coronavirus, only very few will develop FIP. The presenting signs of the disease can vary greatly, making the disease fairly difficult to diagnose. However, fluid buildup in the abdominal cavity, weight loss, and fever are common signs. Affected cats rarely survive, and kittens carry the highest mortality rate. At this time, controversy surrounds use of the FIP vaccine. According to the AAFP, some studies demonstrate protection from disease, while others show little benefit from inoculation. Therefore, use of this vaccine is not recommended for routine use. A discussion about feline vaccines wouldn't be complete without addressing the importance of injection site protocols and vaccine-associated sarcomas. Why are these issues of concern? Veterinarians have noticed an increase in the incidence of sarcoma formation at commonly used feline vaccine sites in the last several years. The exact cause of the tumors is currently unknown, and the incidence of these tumors is estimated to be 1 in 10,000. Although lumps at vaccine sites are fairly common, the Vaccine-Associated Feline Sarcoma Task Force recommends biopsy if any of the following are seen. 1. The lump persists for more than 3 months after vaccination. 2. The lump is larger than 2 centimeters in diameter. Or 3. The lump is still increasing in size 1 month after vaccination. This concludes this section on feline vaccines. After viewing this program, technicians should be armed with an improved understanding of common vaccines, infectious diseases, along with typical presenting signs, and will be able to confidently deal with the inquiries from concerned clients.